So, good afternoon, students. So, in the efforts to the ISFCP regarding the improvement of the teaching learning process, ISFCP is organized a video lecture series in various sessions of the B Farm. So, myself, Dr. Dilpreet Singh, working as an associate professor in the ISF College of Pharmacy, Moga, and I am your subject teacher of biopharmaceutics and pharmacokinetics, that is BP604T in B Farm 6th semester. So in this lecture, I have demonstrated about the introduction of the biopharmaceutics, what is the basics of the absorption, and what is the mechanism of the drug absorption. So before starting the lecture, we have to firstly discuss about the scope of the subject. So the course is designed to impart the knowledge and the skills that is necessary for the dose calculation, dose adjustment, and to apply the various biopharmaceutics theories in various practical problems. So we have also know about the theoretical discussions of the principles of the biopharmaceutics and the pharmacokinetic parameters that will able us to help to students to clarify the concepts regarding the various metabolism pathway, elimination concepts, compartmental modeling, and the nonlinear pharmacokinetics. What are the aim and the objective of the study? The basically the to understand the basics of biopharmaceutics and the pharmacokinetics, to understand the kinetics of the drug absorption using the different pharmacokinetic and compartmental modeling. We also know to understand the kinetics of the drug distribution at the drug administration, and we also know to think about the kinetics of the dose clearance. Basically, we have to understand the kinetics of the clearance in different organ after drug administration. So we also understand the mechanistic aspects of metabolism and the hepatic clearance. We have also known about the nonlinear kinetics, bioavailability, and the bioequivalence study. So at the completion of the course, the student is expected to learn the basic concepts in the biopharmaceutics and the pharmacokinetics, and using the raw data and the simulations, the student can predict the pharmacokinetic models and parameters, and it estimates the best solution and for the understanding the various biopharmaceutical pathways, including the drug absorption, drug distribution, metabolism, and the elimination. So it also helps to critically evaluate the biopharmaceutical studies involving the drug product equivalency. So it's also helpful for the student to design and evaluate the dosage regimen. This is the one of the important course outcome regarding to set the dosage regimen, dosage frequency, and the dose route of the drugs using the various pharmacokinetic and the biopharmaceutical parameters. So it is also helpful for the student to detect the potential clinical pharmacokinetic problems and apply the basic pharmacokinetic principles to solve the various compartmental modeling. What is the tissue distribution? What is the relationship between the distribution of the drug in various tissue and the peripheral compartment using simulation experiments? So in this course, the student can able to understand the complete biopharmaceutical basics, including the pharmacokinetics, ADME profile, compartmental modeling, and the linear pharmacokinetics. So for the reference book, I will suggest you to refer the national and the international books for learning. So for the national books, basically two books they are there: Biopharmaceutics and the Pharmacokinetics by Brahmakar, and Biopharmaceutics by PV Publishers, that the syllabus has been strictly prepared according to PCA syllabus. Regarding the standard referring the books, for more learning, the Applied Biopharmaceutics and Pharmacokinetics book by Leon Chargel and the Biopharmaceutics and the Clinical Pharmacokinetics books by Gilbadi books is available in the hard copy and soft copy forms. The student can refer this book for more and more learning and understanding. So regarding teaching learning process, total 10 lectures has been delivered in various sections of your syllabus. I will try my best to divide the syllabus in a major form. Major form means we have divided the syllabus in different concept of the biopharmaceutics, so we can equalize the concept regarding that is started from the absorption to nonlinear kinetics. So for the understanding the lecture, firstly we have to understand the what is actually a drug. So a drug is injected intravascular. Basically, it directly enters into the systemic circulation. The majority of the drugs that are administered extravascular, it has been given through oral route. So such drug it exert the pharmacological action only when they come into systemic circulation from their site of administration. So majority of the drugs either it given through oral route or either it given through IV route, it exert the pharmacological action at the site of circulation. So if the concentration is the at the site of administration is similar to the site of circulation, then the drug is having the good bioavailability, because the oral drugs basically it absorb through different channels, and the different channel exert different pharmacological activity when the concentration of the drug is under the systemic circulation from the site of administration. Understand? So what is absorption? So absorption is basically the process of the movement of unchanged drug from the site of administration to systemic circulation. So the effectiveness of drug can only be assessed by its concentration at the site of action. So it is difficult to measure the concentration at such site, because the concentration or the driving rate of the drug molecules move inward or upward depending upon the absorption mechanism. So the absorption mechanism is quite a tedious task. We cannot determine the absorption mechanism through in vitro route or the in vivo route. So it can only be determined by the biological access methods. So it is difficult to measure the drug concentration at such sites. So instead, the concentration can be measured more correctly in the plasma. So it is one of the easiest method to determine the concentration only in the plasma, because in the plasma there is a solvent solute partitioning, so we can determine the concentration in the plasma by various quantitative and the qualitative techniques, as there always a correlation between the plasma and the concentration of drug. There is a linear therapeutic response that has been generated by different drugs that have been given through oral route. So in the oral route, there is always a correlation between the plasma concentration and therapeutic response. So in the mechanism of drug absorption, there are different route of mechanism that is basically divided into three types. That is basically transcellular or intercellular transport, paracellular or intercellular transport, vesicular or endocytosis. Intracellular transport is divided into further subtypes, that is passive and active transport. Passive transport is furtherly divided into four major channels, that is passive diffusion, pore transport, ion pair transport, or carrier-mediated diffusion. Active transport is further been subdivided into the ion transporter or ABC transporter and symport or antiport system, that is basically secondary active transport. Paracellular transport is further been divided into permeation through tight junction or perabsorption. Vesicular transport is further been subdivided into phagocytosis or the pinocytosis. So these mechanism will be studied in detail in this lecture. So the transport mechanism it involves different pathways, including transcellular, paracellular, and the vesicular. The transcellular pathway is been divided into passive diffusion and carrier-mediated transport. The paracellular transport is been further divided into endocytosis, pinocytosis, and the molecular junctions. So these molecular junctions are being held by the apical side and the basolateral side of the membrane, and it is covered by the intercellular and the extracellular fluid. So when we taken the drug orally, the drug molecules can move upward or downward gradient depending upon the mechanism is moving towards the apical side to basolateral side of the membrane through through extracellular fluid by different transcellular pathways. So this figure depicts the illustrative comparison of the transcellular, paracellular, and the vesicular transport mechanisms. So we can study now one by one. So transcellular or intercellular transport is defined as the passage of the drug across the gastrointestinal epithelium. So three steps involved, including the permeation of the GI epithelial cell membrane, movement across the intercellular space, that is basically cytosol. The cytosol is a lining that covering the particular transport mechanism. So basically the movement across the intercellular space, that is the cytosol, is basically held through enterocytes, and enterocyte basically it held towards the tight junction. So the tight junction molecules favors the absorption of the drug into the systemic circulation through various transcellular and carrier-mediated transport. So the transcellular transport is basically held by the three mechanisms, that is basically permeation of the GI epithelial cell membrane, movement across the intercellular space, and the permeation of the lateral or basolateral membrane that is held by the extracellular or the intracellular fluid. Transcellular or intercellular transport, it doesn't require any energy. This is basically a energy independent process other than of the molecular motion, that is basically Brownian motion. So the molecule that can pass through the molecular motion to pass the lipid bilayer. So the passive transport process that can be further been classified into the four types, that is passive diffusion, pore transport, ion plate transport, or carrier mediated or the facilitated diffusion. So basically, in passive diffusion, there is a concentration dependent movement of the drug. So the ions or molecules generated during the dissolution or disintegration is moving towards the higher concentration to lower concentration through electrochemical gradient. So this is basically a fixed first law of diffusion. That is the basically the ions or molecules move towards from higher concentration to lower concentration under the fixed amount of the apical or basolateral membrane. So passive diffusion, it is also known as the non-ionic diffusion. So it is the major process of the absorption of more than 90% of the drugs. So the driving force is the concentration or electrochemical gradient. So it is defined as the differences in the drug concentration on the either side of the membrane or the inner side of the membrane, depending upon the electrochemical gradient is produced outside the membrane or inside the membrane. If it is produced outside of the membrane, then there is calculation of hydrostatic pressure. If it is the inside of the membrane, then there is a calculation of capillary pressure, that is basically inside the cell, that is basically in the central compartment. So the electrochemical generated depends upon the absorption, that most of the 90% of the drug is absorbed through inner electrochemical gradient. This is basically on the inner side of the membrane. So passive diffusion is best expressed by the fixed first law of diffusion, which states that the drug molecule diffuses from the region of higher concentration to lower concentration until a equilibrium is attained between the central compartment and the peripheral compartment, till the rate of diffusion is directly proportional to the concentration gradient across the membrane. So it is best fitted by the equation, that is dq by dt is equivalent to dak, that is m by w divided by h cgit minus c, where dq upon dt is rate of drug diffusion, d is the diffusion coefficient of the drug, a is the surface area of absorption membrane, km by w is basically the partition coefficient of the drug between the aqueous phase and the lipid phase, and cgit minus c is equal to the basically the difference in the concentration of the drug in GI fluid and the plasma membrane. H is basically the thickness of the membrane, that is basically the length. So this is all about the intracellular or transcellular transport. So the questions that can be defined in this topic, like the define absorption and enlist the mechanism of the absorption. So what is the difference between the osmosis and diffusion? What is the difference between the passive diffusion and the active transport of the mechanism? Like the passive diffusion is basically require the energy, active transport doesn't require energy. Passive transport is basically held through apical membrane. Active transport is basically held through basolateral membrane. Passive diffusion undergoes the like we called as the movement of the drugs through different ion channels. Active transport is basically movement of the drug through trans junctions. That is basically the tight junctions across the basolateral membrane. So next question is basically the first fixed law. This is also covered under the topic. And what is the concentration gradient? So students, you can remember this question for your future prospects. So there are some MCQ questions based upon your general knowledge. So but basically, what is the major characteristic of passive process? Is the answer correct answer is the A, that is energy independent. What is the driving force for passive diffusion? Is the answer is B, that is electrochemical gradient. connective transport, bulk flow, or filtration. So the driving force is basically a hydrostatic pressure, the pressure that exerted by the osmotic differences across the membrane in a particular cell. So the process is important in the absorption of when we talk about the low molecular weight drugs. The low molecular weight drugs having that molecular weight around 100 to 500 daltons, and basically they are hydrophilic in nature, means they are water soluble. It can pass through the narrow aqueous filled channel, basically the urea, water, or sugar. So the basic the osmotic gradient or the hydrostatic pressure is totally dependent upon the absorption of the low molecular weight drugs. So the chain-like or linear compounds of the molecule weight up to 400 Dalton that can be absorbed by the pore filtration method. So the next important point is basically the drug permeation. So the drug permeation was totally held through the water-filled channels. The water-filled channel basically the aqueous pore channels, and it's surrounded by the tight junctions which were having the prime importance in the renal excretion, or what we call as the removal of the drug from the CSF fluid, that is called cerebrospinal fluid, and it also able to prevent the entry of the drugs into the liver for preventing the first pass metabolism. So, regardless of this application in the port transport, water filled channels is having that variety of the application in preventing the drug from degradation. So, it is helpful to improve the absorption of the many water soluble or hydrophilic molecules and having that molecular weight up to 400 daltons, which exert the good absorption profile. In ion pair transport, the absorption of the drug like the quaternary ammonium compounds and the sulfonic acids, which ionized under the all pH condition, is basically absorbed through the ion pair transport. So the drugs which having that pH dependent solubility. So the drugs which will be ionized at different pH conditions, like acidic drugs. So the weakly acidic drug which been primarily been ionized at basic pH, it undergo partially ionization behavior. So the partially ionization behavior doesn't undergo reabsorption, so it can be absorbed by the ion pair transport. Similarly, basic drug that can be ionized at acidic pH, and it exert total reabsorption under ion pair transport. So depending upon the partition coefficient, depending upon the aqueous solubility, depending upon the pH solubility profile, drug can be transported through ion pair transport under different mechanisms. So the low oil water partition coefficient values, that the agents penetrate the membrane by forming the reversible neutral complexes with endogenous ions of the GIT like mucin. So mucin basically is an endogenous component which promotes the absorption through ion pair transport. So the formed neutral complexes have both the ability to improve the lipophilicity as well as the aqueous solubility, which promote the passive diffusion. This type of the system is called ion pair transport. Let me consider the example of propranolol. Propranolol basically is a beta blocker and is basically a basic drug partially ionized behavior under the acidic condition that form an ion pair with oleaginous compounds. That is basically oleic acid is absorbed by this mechanism. Carrier mediated transport so that like that the lipophilic drugs and the polar molecule crosses the membrane, it more been readily excreted and it more be readily been dependent on that concentration gradient and the partition coefficient values. So we can predict its absorption behavior from the generated energy through downhill concentration or uphill concentration, like monosaccharides, like amino acids, like fat soluble vitamins. Like so, it will be poorly absorbed by this mechanism. So because this mechanism involve a particular carrier, to that carrier that binds reversibly or non-covalently with the solute molecules to be transported. So this carrier solute complex, it transferred across the membrane to the other side where it dissociates and discharges the active solute molecule for absorption. So the particular carrier like the endophospholipid, like the chylomicrons, like the low density lipoprotein, it binds reversibly or non-covalently with the solute. So these carrier solute molecules, when it transfer across the membrane to the other side of the membrane, the carrier molecule it dissociate. It dissociate irreversibly and the active solute molecule is totally been absorbed by the primary circulation. So the carrier then return to its original site to complete the cycle by accepting a fresh molecule of solute. Then another molecule is available. The carrier molecule pick the solute molecule and then transfer again into the membrane. So basically, the carriers in the membranes, they are basically the proteins. That is called transport proteins. Transport proteins like the endophospholipids, endolipoproteins, low density lipoproteins, chylomicrons, or maybe like enzyme like pancreatin, pepsin, like mucin. So mucin basically is one of the important enzyme that has been used by the carrier mediated transport. So basically, this chart it depicts that the absorption in different carrier system is basically saturated or non-saturated according to the absorption behavior of the drug. So when we talk about the carrier mediated transport, the saturable pathways mediated through carriers. So at a particular time, the enzymes or the system are saturated and absorption declining, and then elimination started. But in passive diffusion, there is a net concentration gradient generated by the absorption behavior, and then the absorption begins after completing the disintegration dissolution step and the absorption site. So the passive diffusion is energy independent, while the carrier mediated transport is totally been energy dependent molecule, because energy dependent system is saturated by the enzyme kinetics. Next is the facilitated diffusion. So basically, the carrier-mediated transport is subdivided into active diffusion or facilitated diffusion. In facilitated diffusion, basically it operates down the concentration gradient. So it is the phenomena is downhill transport, but at a much faster rate that can be accounted by the simple passive diffusion. So the driving force is basically concentration gradient, and it held by different passive processes in the body. Since there is no energy expenditure is involved, the process is not being inhibited by the metabolic poisons that interfere with the energy production. So if the interference is not there, the transmembrane proteins, the carrier proteins, it facilitates the entry and exit of the molecules, and it promotes the adequate absorption of the lipophilic as well as the hydrophilic drugs. So the questions that are covered under this topic, that is like the what is to understand by the Singh condition and how it is maintained. List the characteristics of the passive diffusion of the drug. What is the absorption rate of the relatively water soluble but lipophilic drug that always greater than its rate of elimination? This is basically a what we call a twisted question. What are the characteristics of the specialized transport system, and what are the kinetics of such process by described? So when we talk about the lipophilic drugs, when we talk about the water insoluble molecule, the rate of elimination is always been greater because the a partially ionized behavior, that is pKa, it doesn't allow the drug to be reabsorbed. It always leads the parent metabolite to be excreted against the concentration gradient. So the absorption rate of water soluble molecules is always greater than its rate of elimination. So when we talk about the characteristics of specialized transport system, it should be not be energy dependent. If it is energy dependent, then there is a saturation of the system, and absorption is greatly declined at some time. So when we talk as energy independent system, then there is no saturation and absorption is adequately maintained. And when the peak plasma concentration occur, then rate of declining it started. So basically, what are the MCQs? The MCQs basically what is the major difference between the facilitated and the passive diffusion? The answer is basically B, downhill transport. What is the driving force for facilitated diffusion? Is answer is the C, that is basically charge equilibration and the concentration gradient. Third question is the what kind of molecule that cannot pass through a pore transport? Basically, answer is the C, that is molecule up to 400 Dalton, because the greater than 400 Dalton molecule, the ion channels, they are basically very small in shape. So they can't adhere a peptide or protein molecule. So basically, the C is the right answer. What is the driving force for port transport? Is basically the answer is B, that is concentration gradient. What will be the best definition for a carrier? So the answer is basically B, that carrier it bind reversibly and non-covalently with the molecules. Okay? If we talk about the D, the carrier is a protein, but the protein is not a carrier. So basically there is a confusion. So in the correct answer is the B. Third is basically the active transport. So this transport mechanism, it require energy in the form of ATP. So active transport mechanism therefore further be subdivided into primary active transport. So in this process, there is a direct ATP requirement. So direct ATP requirement like that, it converts it, what we call it replenish, or it converts the ATP to ADP through tricyclic acid cycle. So the pyruvate it converts the ATP molecule, and when the one ion or molecule comes up through disintegration or dissolution through oral route, the molecule can be transported across the concentration gradient through apical junctions. And when the molecule transport, there is a net change in the energy. That is called a unipolar system. Unipolar system basically comes with the absorption of the glucose. So two types of the transporters they are available in the primary active transport, because prime active transport is basically held in the intestinal or basolateral membrane. So in the intestinal epithelium, there are a number of transporters that they are available. So in the ion transporter, basically there are two types, that is called organic anion transporter or organic cation. Organic anion transporter is used for the acidic drugs or negatively charged drugs like the atorvastatin. Like we have the phenytoin, phenytoin, chlorodiazoxide, diclofenac, or NSAID molecules. Organic cation transporter, it is used for the absorption of basic drugs or negatively charged drugs like the diphenylhydramine, chlorodiazoxide, diisopyridamole. Then we have the carbonic anhydrase inhibitors like acetazolamide. So there are the number of binding cassette proteins also that effluxes the drug outside the cell. So there is the influx efflux mechanism. It influx the drug molecule and it efflux the energy molecule. So that is if the equilibrium is attained between the influx and the efflux, so there is a generation of the energy gradient, and we can calculate the absorption behavior of that drug undergo active transport system through the energy gradient process. Regarding the secondary active transport, so in this process, there is no direct requirement of ATP. That is, it takes the advantage of previously existing energy gradient. So when we talk about the existing energy gradient, then there is when we talk about the energy gradient that is charged between the RPC cells undergo capillary movement. And when the energy is generated under the capillary flow or the renal flow, then we call as the existing concentration gradient, and the secondary active transport utilize this type of the gradient to transport the molecule from one basolateral site to the another. So the energy required in transporting an ion, it generates a multi-step mechanism that is called co-transport or coupled transport, either in the same direction or in the opposite direction. According this, the process is further been subdivided into SIM-port system that is called co-transport. It involves the movement of the both molecule in the same direction, that is called sodium glucose SIM-porter. Antiport basically that is called counter transport, and it involves the movement of the molecule in the opposite direction. That is basically the mechanism. It involves this proton sodium gradient and sodium potassium gradient in the kidneys or in the liver. This picture depicts the primary active transport and the secondary active transport under counterport or symport mechanism. When the concentration gradient is generated from lower concentration to high concentration, that is called the hydrostatic pressure or the pressure generated in the capillary wall. Then there is a held increase in the primary active transport by the energy gradient, that is from ATP to ADP, and there is a coupled mechanism which undergo a symport system, that is drug molecule can move one basolateral membrane to another basolateral membrane through adjacent direction, that is basically a inline direction, or it is basically opposite direction, that is basically antipode or outline direction. Next transport is the paracellular transport or intercellular transport. The paracellular or intercellular transport, it is defined as the transport of the drug through the junction between the GI epithelial cells. So this pathway is of minor importance when we talk about the drug absorption, because the majority of the peptide, majority of the drug that can be absorbed through nasal route, topical route, that can be absorbed by the paracellular transport. So, however, majority of the drugs that can be absorbed through oral route. So, in oral route, there is a limited scope regarding the paracellular or intercellular transport. Regarding the transport mechanism, there are two types of the mechanism, that is permeation through tight junction of epithelial cell. So this process is basically occur through the openings, that is basically which are little bigger than the aqueous floor. So the openings which promote the absorption through tight junctions like the insulin or like the cardiac glycoside, they are taken up by this mechanism. So perabsorption is basically the permeation of the drug through temporally openings. That is called temporal or that is called temporary openings. It is found by the shedding of the two neighboring epithelial cell into the lumen. So after the shedding of two neighboring epithelial cells, there is the influx movement of the molecules or ions through an electrochemical generated from the intercellular fluid to extracellular fluid and held by the tight junction. So when the drug molecule move towards the extracellular fluid, it undergo prime absorption in the blood. And when we talk about the subdivision of the paracellular transport, then there is a phenomena called endocytosis. Like active transport, there are many energy dependent processes that involve the transport of the substance within the vesicle into a cell. So since the mechanism it involves the transport across the cell membrane, so the process it can be classified as transcellular, paracellular, pinocytosis, or phagocytosis. Pinocytosis is basically we have called this cell drinking. The vacuole is formed in the cell mechanism and it allows the formation of a protective layer under the vacuole, and this vacuole promotes the absorption of various macromolecule nutrients like the fat, starch, oil soluble vitamins like A, D, E, K, and water soluble vitamin and B12. When we talk about the phagocytosis, that is called cell eating, the vesicle is formed at the absorptive site of salt particulates. And basically, the phagocytosis mechanism it favors the lymphatic circulation. So these type of the mechanism it bypassing the hepatic first pass metabolism, and it promotes the absorption of many lipophilic and the water insoluble compounds. In this picture, when we talk about the phagocytosis, then there is a absorption of the molecule under the gut microbiome. In the gut microbe, there is a chain regarding the digestive enzyme, partially digested molecule, and the residual body components, which are taken up by the phagocytotic mechanism, and it leads to the formation of a phagosome. So the fusion of the phagosome with the liposome, it form a phagolipozyme. The phagolipozyme, it been digested by the ingested microbe and it forms the residual body components containing the indigestible material. So the discharge of the waste material it been occurred by the different type of the mechanism which initiate the absorption process. When we talk about the pinocytosis, the vacuoles so formed that are uptaken by the drug and it coupled with the extracellular fluid to promote the absorption in cytoplasm or in the cytosol. So the question in this topic that which we need to cover is the why it is advisable to administer vitamin B in these small multiple doses rather than a single doses. Why? The answer is that the administer vitamin B in multiple doses, it absorbed by the poor transport mechanism, which doesn't allow the absorption of higher doses because higher doses need larger openings, and the poor transport allows the movement of the drug through small openings. So it is always advisable to administer vitamin B in the small multiple doses. So, what is the similarity between the passive and the facilitated diffusion? Similarity is basically both involve the energy gradient and differences is the passive diffusion. It allows the molecule with less than 500 Dalton. Facilitated diffusion, it allows the absorption of molecule more than 500 Daltons. So how are ionic or ionizable drug absorbed? The ionic ionizable drug basically dissociate under different acidic or pH condition. So I have already discussed that the acidic drug, even the pK is more than 12, that basically it completely been ionized. The completely ionized drug, it extensively absorbed and having that rate of excretion poor. So basically, your ionizable drugs which having the pK value greater than 12, it is called basic drug, or less than 2, that is acidic drug, that are the unique for the absorption under primary epithelium. Next question is the which one is the only absorption mechanism for which aqueous solution of a drug is not a prerequisite? The answer is basically the active transport system under carrier mediated transport. So suggest the likely mechanism for the oral absorption of the following agent: lithium, that is absorbed through passive transport; ibuprofen, carrier transport; cyanocobalamin, ion pair transport; methotrexate, port transport; quaternary ammonium compounds, port transport; and insulin phagocytosis. So the MCQ regarding this topic, that what kind of drug that are absorbed through endocytosis. So the correct answer is the B, that is water soluble agents. So which drug they are absorbed through port transport? The answer is high lipophilicity. So the high lipophilic molecules that are been easily been absorbed through the port transport. Third question is the which of the absorption method that involving the engulfing of the extracellular drug? So the answer is the C, that is facilitated diffusion. So which is one is the other name of cell eating, that is called phagocytosis. For fifth question is the what is the phenomena that need to transfer an endocytic vesicle from one extracellular compartment to the another? So the prime mechanism is the C, that is called pinocytosis. So this is the reference that I have suggested you to refer the PCI syllabus book and well as the standard book for knowledge. I have referred two books, that is Burmaker for the adoption of the drug and the Sharjal for the applied biopharmaceutics and the pharmacokinetics. So thank you very much for your consideration. For any suggestion, you can contact to me at the listed address. Thank you very much.